Hi, everybody. I am Jen Johnson, and this is Thought by Thought Healing, where I talk about everything related to mind body syndrome, TMS, or neuroplastic pain, and I come at it from a Christian perspective. Today, I had the honor of interviewing Dr. Bobby Geevarughese, and he and I are going to discuss physical therapy from a mind body perspective, his own healing journey, and the role of grief and parenting, and our shared faith of Christianity in this message. So, a little bit he wrote about himself on his website that I will also put in the show notes is that I am a licensed doctor of physical therapy with over 13 years of experience in both inpatient and outpatient rehabilitation. I completed my undergraduate degree in electrical engineering, and from my own health struggles, I made a radical shift from engineering to healthcare. I'm committed to helping individuals suffering from chronic pain or disease through a biopsychosocial and pain science approach with the goal of helping you avoid any unnecessary surgeries or medications. I really appreciate that last part because there's so many of my clients that have ended up going through a lot of surgeries and medication that they didn't need in the long run. So I hope that you enjoy this interview. If you have any questions or emails, you can email him on his website. And again, I'm going to put that in the show notes along with how to contact him. To follow me, you can follow me on Instagram and Facebook at Thought by Thought Healing, and also check out my website where there is a pain test that you can take that would help you to rule in if your pain is created by the brain. All right, everybody, thanks and enjoy. All right, well, thanks everybody for being here, and specifically thank you to Dr. Bobby Geevarughese. Did I say your name
Yeah.
close to right?
Yeah.
Okay, great. Thank you for being here.
Sure. Thank you very much for having me. I really appreciate it.
Yeah. So we're going to try to cover two things today. One is your story of healing and your symptom story, meaning what was really underneath your symptoms, and then also your physical therapist, right?
Yes.
Yeah. So we'll talk about what you do in sessions and how people can maybe contact you and work with you.
Okay, perfect.
So let's just start by you telling us a little bit about who you are and your story.
Sure. Yes. So I'm a physical therapist. I've been a physical therapist since 2011. This is actually a second career for me. I graduated from college with a degree in electrical engineering. I did a minor in computer engineering. So from there, I tried to work at least. I live in New York, so I moved to Delaware at least at that time. And so I was living in Delaware for about a year. And while I was working there, I actually had a pneumothorax, which, if people don't know that, that's when you have a collapsed lung. And so it
Oh,
just can happen unexpectedly. They call it a spontaneous pneumothorax. No family history of this at all.
huh.
Uh, Caught me by surprise, of course, when this happened. I wasn't really doing anything strenuous. And so went to see my doctor, told me what it was. He said within a few days it should heal. At that time, it was about like 5% collapsed. Then 3 weeks later, after a few days, it got better. But then 3 weeks later, I came back from vacation. I was literally about to drive back to Delaware. And then the same symptoms happened again. You get like shortness of breath, pain in the chest, things like that. Went to the hospital again. This time it was 30% collapsed. So same side, right side. So at that point, the surgeon told me it's going to keep happening and it'll keep getting worse. And it can be a dangerous thing to happen for anybody. So he's like, you can go for the surgery, which has like a 90+% of like success. So I opted for the surgery, sure. So in the surgery, they kind of take out a portion of your lung and they kind of do all these different things to try to create this space. So what happens when you have this condition is just you might create bubbles on the lung. And if they pop, it lets air out of the lung. That's why. So they try to just keep the lung kind of pasted to the chest wall. So there's no room for these bubbles to grow. That's basically what they do in the surgery too. So I
Wow.
did that surgery. I was home for a few weeks recovering. I had to spend a few months really time off. I mean, I had to go back to work anyway, but a few months time off exercising, doing any activities like I was used to doing. And so that was a tough time for me. I think just even psychologically, even just because I was so used to being independent. I mean, I was 22. I was
Mm.
doing the right stuff in quotations, right? And then still having something like this happen really blindsided me. And it really just kind of made me think about, well, anything like this can happen and life's too short to be, especially in the work that I was doing. I wasn't necessarily enjoying the work I was doing. It was a job, but it probably wasn't my first choice, right? I always did like healthcare. So at that point, I decided to switch careers. And so I decided
Oh.
to go between either a physician's assistant or a physical therapist. After I volunteered for physical therapy and I learned more about it, it's when I decided to start pursuing classes for that. And so I took some night classes, I volunteered, I was still working full time as an engineer, so I still did those things on the side. And so
Whoa.
yeah, it was probably doing too many things.
Been there, done that. Okay.
Right.
Hmm.
Yeah. So I didn't realize it at that time, but I was living
Hmm.
on my own, so I kind of had to do all these things. But again, probably doing too much. But then after I got into school eventually in 2008, graduated 2011. So it took me about 5 years to do everything. But then I finally finished. And so now I've been working in the hospital setting for the most part since that time. I did do some private outpatient as well. So that's where I am now, at least. Mhm.
You're in the hospital setting right now?
I work in a hospital, yeah. So I've been in the
Oh,
hospital since when I graduated. I was in a rehab center, and then I started in the hospital in 2012. After I got married, I moved, so I was away for a little bit, and then I came back. But in the hospital, I was doing both inpatient and outpatient care. They just
okay.
closed our outpatient center a year ago,
Okay.
so now I'm just doing bedside care at this point.
Okay. So so you're working in the hospital. Are you when you're doing TMS work,
Mm.
is that through the hospital or through private practice?
No, that's so when I was working outpatient, that's when I tried to do the TMS work at that time. Again, very challenging in a hospital setting.
Yeah.
So I did what I could.
Yeah.
But now private practice, this is where I really tried to do this on my own. I mean, I switched to private practice because doing this in the hospital, bedside care is one thing, it's not possible, right? But but you could always be there for people emotionally, psychologically. There are many things we could still do for people, even in acute stage. Um,
Can you tell me what you mean by that with bedside care? You can't do TMS work?
So like if we're talking about a traditional working with somebody one-on-one, and if
Yeah.
somebody's come, I mean, many times people come for TMS work, it's like on an outpatient basis, like people are coming to see you. And bedside, so it's mean is like you're going to the hospital room and working with somebody, for example, who just had a surgery, and
Yeah.
it's
Gotcha.
the yeah, first day or
Yeah.
something. So
Yeah. You're
it's
not doing TMS work. I see
no,
what
no,
you
you're
mean.
not.
Yeah.
Mhm.
I thought you were trying to imply that to have good bedside manner, you couldn't bring up the idea of it mind body being mind body.
Oh, oh,
And
mhm.
that is not what you were implying. So
Yeah, no, I mean, there are definitely conditions even in the hospital where I'm sure people come in. I mean, I think they were talking about the research that many ER visits are like stress related. So this would be relevant work. Okay, yeah,
yeah.
right. But we're
Yeah.
not practicing that in my hospital, let's say.
Yeah. Yep.
Yeah.
Okay, so we're up to present day. Let's go back a little bit. At what point in time did you find that you had mind body symptoms or TMS symptoms?
Okay, so this is interesting because when I started doing this work, so 2011 is when I graduated. So let's say in 2015, I moved up to Albany, upstate New York, where my wife was. And so she was up there. And so I went up there to live there and work. I found a job at a private outpatient. One thing to say is that at least TMS, I remember having symptoms even when I was younger when I did this work. I remember when I was
Mm.
young, maybe 7 or 8, sometimes having back spasms that I couldn't even go to
Whoa.
school. Right, yeah, and at that
Whoa.
time, at that age, I didn't think anything of it, but I mean, it's odd at that age, and sometimes stomach
Mhm.
pains, symptoms like that. And I remember it
Okay.
kept me out for a day or two, and again, no trigger that I could think of at the time. And I mean, I can't remember at this point also what it could have been.
Okay. Yeah.
But when I was in Albany, I was working at an outpatient center. I was there for just a little bit, and it wasn't a good fit, and so I left there. But I decided to at least see the therapist I knew because he was also a very good therapist, and I thought for myself, well, over the years, even when I was in PT school and beyond, I did see my own physical therapist. I mean, I had chronic back pain for a long time, elbow pain, different, pains like that. So I would go see a physical therapist anyway. When I
Wow.
was in school, he was good. I mean, he knew his stuff. He really helped me out. A lot
Yeah.
of hands-on work, exercises, things like that, right? I mean, none of this type of work, nothing more psychosocial, any of those connections.
Yeah.
But even after that time when I left there and went to this new place, even in Albany, I was still dealing with some, symptoms, and the one severe symptom I developed was hip pain.
Mhm.
And that one, I only had that one a couple of times before, but nothing to this level. But this was like pretty severe. And even though I went to this PT for like almost 30 visits in Albany, it didn't get better. If anything, it
Yeah.
was only getting worse. And so at that point, I decided just to stop. I'm just kind of like, there's no point. I'm going to just maybe try something on my own. That's when I'm just searching online, going to Amazon and, searching like, okay, what books are out there for, let's say,
Yeah.
back or pain, right? And when
Yeah.
I saw The Divided Mind by Dr. Sarno, I
Mhm.
remember a year ago reading this and, oh, you have it over there? Okay,
Right
there.
there.
whole collection, yeah, right.
Yeah.
Yeah, my collection over here too. So, when I read The Divided Mind a year ago, the synopsis, I thought it was actually ridiculous. Me being a traditional physical therapist,
Yeah.
I'm like, what is this? Emotions causing like back pain or something? I'm just like, this is nuts. This doesn't make any sense.
Mm.
you know, didn't even think twice about it. But here I am a year later. I was like, I've tried everything else. It has a lot of positive reviews. That book, Healing
Yeah.
Back Pain, My Body. So I was just kind of like, I'll just go to the bookstore and just go check it out. But so I read Healing Back Pain at like Barnes and Noble, but it was really eye-opening. Just a book like that, especially for me coming from my background, it really contradicted a lot of things that I learned in school and what I was practicing, but it made a lot of sense, like kind of all the education we give people and making people almost more fearful of movement and always doing the right thing or they're going to hurt themselves. And so that was helpful. The knowledge was helpful. The key piece of knowledge for me at least was the fear of movement component. When he was speaking about that, I noticed for myself that that's what I was doing. I was being
Yeah.
more mindful of how I would bend down to pick something and
Yeah.
checking out my symptoms and everything, right? So
Yep.
I just little by little started adopting that mentality of like, okay, I'm okay. I don't think there's any major injury here. I went to go get checked out, but it's only getting worse. And it's kind of waxing and waning, sometimes worse, sometimes better. And within a week of doing that, the hip pain was gone,
It
zero
was
out of
gone.
gone, 0 out of 10, from a 9 out of 10
Wow.
to 0 out of 10, right? And so that was eye-opening. Granted, I probably developed other symptom imperatives after the fact, right? But comes with the territory.
For people who are listening that don't know what the symptom imperative is, what is it?
So it's just when you're dealing with a symptom, and let's say if that symptom does go away, or if you're maybe dealing with one symptom that's your primary symptom, your body or your brain might then start choosing other symptoms to focus on. Really, it's almost like a way to kind of fight off this coping mechanism you've had for so long, that's worked for so long for your mind, and your body and your brain. They're going to kind of fight to keep that coping mechanism going for as long as possible. And so for me, I had several others that eventually
Hmm.
came up. I worked with my own pain coach too. That was something I
Oh,
made the decision to as well. Yeah, and then for
yeah.
me, that's what made a real big difference as well. Is just really learning from them, their experience, and kind of just getting help through different symptoms that I've had over the years.
Was your pain coach TMS or mind body informed?
Yes,
Yeah.
yeah, like a TMS coach, like specifically.
Yeah.
Mhm.
Okay, cool.
So then from there, after dealing with that and getting better and then learning about this work, that's kind of when I've been on this journey on now since 2015, at least, learning more about this work and again, trying to apply it in the hospital setting.
Yeah.
Sometimes successful, but more challenging than not because it's such a different environment to try to practice work like this, especially if you're the only one practicing this way in a clinic,
Absolutely.
right?
I can't even imagine.
Mhm.
Okay, so on your website, it says faith, hope, healing.
Mhm.
Um, I think that we have something in common here. Tell me about the faith portion of this, or hope.
Sure. Oh, sure. Yeah. So faith and hope, from our faith background, Christianity at least, I think of faith as belief. And, I think in doing this work, coming from our perspective and our background, it's believing in God, believing in the work of the diagnosis, believing that we can get better.
Mm.
I think that's a big part of the work. Is that side of it is really just being able to believe that you can get better as well, almost like you're
Yeah.
allowed to get better. I know, that might sound odd to people, but I think sometimes people may feel like they're not supposed to get better and feel better, right? That they're just meant to kind of deal with this. And so
Uh-huh.
I believe at least that's where faith steps in as well. And it's belief just to
Yeah.
believe, no, you can get better. You ideally should be able to get better. Again, depending on the condition of what we're dealing with in life, if it's
Yeah.
or something else, other structural disease, right? So
Yeah.
mhm.
Uh, um, there's so much to talk about in those last few sentences, but I even actually just finished a session with a client who has cancer right now.
Oh,
And prior to having cancer, she had a whole laundry list of mind body symptoms that we've been working through. And
mhm,
she had a ton of recovery, and then cancer came about. And so she is treating um, this structural issue
mhm,
with the same set of skills of less fear and frustration and all the F's that
mhm,
is helpful for her. So yes, she has something structural, and we're not trying to necessarily make the cancer go away, but some of these tools I think are really helpful even when we have structural issues.
Yes, absolutely.
Which is
Hmm.
really cool. Okay, so going back a little bit, you read Healing Back Pain, pain in the hip went away, and then symptom imperative comes on. And before we hit record, we were talking about some things that you knew were part of your story of your brain and body being activated. You mentioned grief. Can we start there? I think my story is less related to grief, and
Hmm.
so I know that for many people, this is part of their pain. So
Hmm.
I just love if you would share your your experience with this.
Sure, yeah. So for me, grief, after that time, so this was in 2020, my brother passed away. He was 38. He passed of a heart attack. And so that was, of course, just a big shock to our whole family, and we were only 1.5 years apart. So we grew up basically doing everything together. So even in that time, so it'll be about 4 years this year.
Mhm.
Even the week that he passed, I remember I might have been sitting down to write his obituary with my like his wife, so my sister-in-law, right? So we were
Yeah.
sitting down together to write his obituary. And I think that was the event. But so we were there for a couple of hours, maybe writing this. Many of the time it's like, 12, 1 in the morning. It's such a long week. You have to do a lot of things. And I think when I stood up, I felt like something almost snap in my hip. That's what it felt like. It's something all of a sudden my just like hip just went out. And I just had
Wow.
severe shooting pain in my hip. And again, I was sitting for a couple hours standing up. Your brain starts thinking like, oh, maybe you're sitting for a while and you stood up too quickly. And I'm like, well, how many times have I sat for hours in life and maybe stood up
Yeah.
and had anything happen, right?
Yeah.
And so I was like, I don't know if it's that, but when you're dealing in the midst of all this, can't really spend the time too much time to think of for yourself. At that time, I couldn't. They're like, what's going on? How am I going to deal with this? So I just dealt that week with it. Take medicine as you needed to, do what I can to compensate. That's all I could do because there's so many things to do, right? But
Yeah.
stayed the same all week long. But again, after the week passed, I worked with my pain coach again, to talk about these things. And so,
Yeah.
and so we were making some connections at least as well. And like
Mhm.
that was enough to kind of almost turn the signal off then,
Yeah.
making these.
Wow.
Yeah, but it was
Yeah.
so powerful. And so what she taught me as well was, when we go through such significant traumas in life, right? Like again, the brain's going to step in to help us out because physical pain is going to be preferable to emotional pain.
Yeah.
And so that's why a lot of our symptoms come about. And even in the time since he passed, and so grief to me is it's so powerful. And we were talking about this before. Like I feel if anyone speaks
Mhm.
of grief or the idea that the mind and body aren't related and the mind cannot affect the body, all you got to look is at grief and look at any grief
Mhm.
organization, any association that exists out there. And you could easily look up on their websites, what are some common symptoms that you will experience in grief? And they will list a whole number of physical symptoms that you can get with grief. Pain is one of them, insomnia,
Wow.
GI issues, fatigue, which I experienced a few of those at least
Yeah.
in time. I had trouble sleeping, fatigue. Yeah, at times when we hit specific milestones, I was exhausted and I couldn't make the connection. So
Mhm.
even in my faith, we do like a 40-day memorial after that day passes,
Yeah.
and so at that 40-day memorial, we just do another a service. But even that weekend when this is happening, I was exhausted. I was taking like 4 naps a day almost, and I couldn't really at
Wow.
that time make the connection of what was the reason. And as I learned more about
Yeah.
the work, then I understood it was just really my brain body's way of really just helping me out. It was just like so
Yeah.
much to deal with and process. So this is
Yeah.
a way to kind of recover is take it easy. And so since that time, since we've had milestones, you have birthdays, anniversaries, the year of the first is very hard. That's what many people will say. So in just that first year,
Mm.
of course, when you have, his birthday pass or a special day even for yourself, your own birthday, and then they're
Mhm.
not, you think about these things. So it's not so much a joyful day as it was. And then you might find that you might have symptoms, creep up at those times, and that's like all normal.
Yeah.
Again, it's just a way our brains are trying to help us really. And so
Do you think for you, when you were grieving, that you were grieving? Do you think that you were suppressing the grief, or were you facing the sorrow on those days during that year of firsts?
It was challenging. Yeah, because I was mentioning before, so I have a 4-year-old. And so my
Yeah.
daughter at that time when he passed was 7 months. And then this was
Wow.
COVID time. And COVID at that time, my wife and I both work in hospitals, and she had to still go to work. And I was primary parent then at that point. And trying to parent a 7-month-old when you're just grieving such a traumatic loss is hard. Parenting's already hard, right?
Yeah.
We were saying. Then just grieve on top of that is makes it 100 times harder. So I was fortunate in the respect of that my parents were totally okay with me coming to get help from them, spend time with them. It was beneficial, right? It was helpful
Wow.
for them that my daughter could be there with them also in their time of grief. It was helpful for me to be around my family and have help with her too. So
Yeah.
it was hard, yeah, sure, being able to process those emotions because it's like you don't have time to, especially if you have a child that really is a lot of care, a lot of necessary care, right? I mean, thankfully, my wife's so helpful that she could take a lot of the burden and help out. At least I don't want to say like burden, but it's just a lot of work, and so she could help
Yeah.
me in the times that I needed to work with somebody and talk about things and work with a counselor even too, and work through grief.
Yeah.
That was at least helpful in that time too, to be able to work through it.
Yeah.
Mm.
Did you have any point in time during that journey that you were tempted to wonder, is this structural? Or was it a pretty easy, now I've, like you were talking about earlier, that
Mm,
faith, that belief that you can heal, and the diagnosis is
mhm.
such, it is such a pivotal part. So what was
Yeah.
that like for you?
I think because maybe just my background, being like PT, and again, in musculoskeletal is going to be maybe more my specialty, right? So I work with more. But if it
Right.
comes to like fatigue or insomnia, again, those are different elements, and I
Yeah.
mean, it's not something I deal with as a physical therapist, let's say, but
Uh-huh.
I think as I learn more about grief, and I spend the time to learn about grief. I mean, I read books, and that's what was helpful as well. You learn from kind of popular authors telling you about all the things you may experience. And so, and again, it's different. Like we were saying, like, when you have grief, when they talk about, when something's coming and maybe like a death is coming or like versus something so sudden and traumatic, it's
Yeah.
just different. We grieve in different ways. And so it's just, there's a different element to a sudden loss, like a young age, that I can make those connections, and getting help to make those connections, that was the cause of my symptoms. I think knowing this work, it played a big part in it, because even if you look through any of these sites, like I was saying, at least they made the connection that grief can cause these symptoms, but I don't know if they kind of connect it the way they do in the work here with like TMS to
Yeah.
understand more kind of the scientific background to it, what goes on, but
Yeah. Yeah.
it's still relevant.
Yeah. I um I just appreciate you talking about this, because I know that there are many people that we just, as a culture, I don't think we know how to
Mm-hmm.
process or deal with grief, and since emotion is often seen as weak,
Mm-hmm.
um, then we're strong, and God protects us from feeling these emotions, quote
Mm-hmm.
unquote.
Sure.
Um, and in reality, I think He wants to be there with us. And as we talked beforehand, I'm learning from you a little bit. I know that I am going to be facing a death in somebody that's very, very close to me in the next few years, depending on chemo outcomes. And um, so trying to learn, how does one grieve? How do I go to God with this mess that I feel,
Mm-hmm.
and allow Him to be part of this process? So
Mm-hmm.
thanks for sharing some of your insight there.
Sure.
um, I'm curious too, you bringing up parenting.
Yeah.
um, did you find, I mean, I first of all, I don't know why, but I haven't had very many people talk about grief, and I've only had a couple talk about parenting. So I'm curious,
Okay.
those two things happening at the same time, a 7-month-year-old, that's very little,
Yeah.
um, and then grief. And I'm wondering about the conflict of emotion, um,
Mhm.
between those two things, or if they were similar. Was it like, did you feel a need to be happy? Did you feel frustrated? What were
Mhm.
some of the emotions you didn't want to feel that maybe you were feeling, with those two things happening at the same time?
Sure. Yeah. I mean, having parenting in general is hard. Yeah, I
Yeah.
know most people don't say that. Social media doesn't put that out there. Makes people have many kids and they can do everything in the world. But I will say, look at how many parenting books are written and look at how many reviews are written for these books. And you see plenty of people saying, thank you, I needed this because I didn't know what I was going to do. And even if
Yeah.
you go to some of these popular parenting experts and look at their websites and their message boards, and you see many people struggling. Many people have such a hard time. They don't know what to do as a parent.
Yeah.
They don't know the solution. And so people struggle. Parenting, uh, as it relates to like TMS work and causing symptoms. So one thing like you were asking me about with my story, it's when you're trying to grieve and you want to spend that time grieving and you can't, that's hard, right? And you have, a baby that also needs a lot of care. And so it can be very frustrating for sure, and you're trying to find that space or where can you express your emotions and
Yeah.
in healthy ways. But it is very challenging, right? And I think as parents, because parenting does require a lot of your effort, especially when you have a newborn baby, you have sleepless nights,
Mm.
constant around
Mhm.
the clock. And if you have a child who's colicky, you're just crying a lot, that can be triggering for a lot of people as well, because a lot of this can relate back to your own childhood. And so it can really bring up a lot of that own trauma if you had that in your life. And then if you're trying, especially to kind of be a cycle breaker and parent differently than you had growing up, and if you're struggling there, you can feel shame for yourself as well, just kind of not hitting the standard that you're hoping to hit. But it's all normal, and it's all a part of the process. But it's like making that effort to at least try. And even if you do act in a way that you regret, there's always possibilities to repair your relationship anyway with your children too. That's a big plus as well. And if we're not taught that growing up, again, we're not going to know how to do that. So I think that's just like a new process. And I think for people when they do this work, when I've had patients and I've worked with them, just validating the parenting is difficult, it's helpful for them. They
Yeah.
validates what they're experiencing because most people aren't talking about it. And yeah, and so that's why I would just tell them, like, again, it's okay to feel frustrated and angry and upset when if your child does something, again, you're trying to have a great relationship, but it's normal for their age. But how can you find healthy ways to express that anger? How can you find healthy ways to have self-care, set boundaries and limits, get help if you're able to get help, right? It's like all these options we'll try to explore, to try to just lower that amount of kind of that high alert brain they talk about, like Alan Gordon talks about, right? How can we kind of bring that down so you don't have to do as many things?
Yeah. I love what you just said about how can I express my anger? And let's just be clear, we're talking about anger towards parenting, right? I
Yeah.
mean, I feel like that is I think it's in Sarno's book that he said he like ranks the top things that cause or can be
Mm,
the underlying cause of chronic pain. And I think he said marriage and marriage and death, and
mm.
then a new child, or it's right, it's I'm gonna get butchered for misquoting
Yeah.
Sarno. Somebody
Okay.
please put in the comments what I've done wrong, because if I invite the criticism, it feels better.
Uh,
So I just know that up there is this idea that we have children, and all of a sudden you have this responsibility for
mm,
their emotional state. I don't have kids, but this is what I
mhm,
understand. And then
mhm.
you're also trying to juggle this big change in your life. So any advice you would give to, I'm hearing, I already heard your advice, like for the people who have parent or who are parents, finding healthy ways to express that anger. What about the grief? Do you have any tips of people who are maybe suppressing that grief? It's showing up in their bodies. How does one move towards that?
So I think again, it depends on the resources you have available. If you can work with a grief counselor, I think that's always helpful, because
Yeah.
it's heavy work. And if you have a family, try to share. I mean, again, my wife is very supportive and I'm grateful, but it's a lot also to take on, because your emotions can wax and wane. And so if you have someone who's trusted, again, trusted friend is one thing. If you do have that, great. But to find a counselor who's kind of professionally trained can be helpful.
Yeah.
I think time is what people speak about as kind of one of the ways you need. It's one of the best ways to help, really, because everything becomes so acute in those early phases that time does help. I mean, now for me, 4 years, so that time factor has helped at least where things don't sting as much. But I think the idea is to embrace what you're feeling. Like you were saying before about grief. Oh, society, we stink at grief,
Yeah.
because grief, like you said, is seen as weakness, and people want to live a joyful, happy life. It's kind of what we're taught. Life, liberty, pursuit of happiness. grief doesn't belong in that. And it's really, people talk, I mean, you hear about people's stories of grief, and there's some interesting even YouTube videos where people speak of grief and their losses. And, when one thing is having a loss, right? But what you experience after a loss is also can be very difficult because your relationships, family members, friends, again, well-meaning people who tell you this is God's plan for you and your God's plan to, for this to happen, and you're just kind of like, no, not at all. But you hear all these things, and again, that also can make this situation much more difficult. And so it's really learning to be able to process that. But for yourself, like we say, you feel the emotions like anger, you feel anger. And a lot of what comes with grief, we think of sadness, but it's really anger. Anger
Mm.
is actually really the main underlying emotion, because you're angry at the person you love is gone. You're angry at the life you could have had with them and with your children or family members, the experiences
Mm.
you're missing. And again, grief is there too, because you're grieving that ideal life that you now aren't going to be able to have. And so anger is always one of those main things people don't think about, but
Yeah.
and then you see what other people have as well in their families. You might have all these thoughts that we might think like, oh, I can't have thoughts like that. But again, these are just like natural thoughts people have when they have such a trauma in their life. We say things, ideally we can go back on it. We might not mean that, but in our acute stage of whether we feel angry or we're grieving, we think our emotions out loud and we're saying what we feel, and it's okay. The whole point is to allow the space to allow all those things, because it's just naturally what we're feeling, and it's unfiltered, and it's kind of how you work your way through it.
Yeah, absolutely.
Mhm.
Okay, thank you. Thanks for your vulnerability in that story.
Mhm.
Let's see. Okay, in closing, I do want to transition to talking about your PT work and what it's like to work with you. I know that I have clients sometimes who we're doing the emotional work, but there is that fear of movement,
Mhm.
and they hold back out of wanting a green light from somebody that studied the body.
Okay.
And that's where I think um, medical professionals like yourself are we just need more of them in
Mhm.
the world. So first of all, thank you.
Sure.
And so I kind of look at it like, first we learn the pain science to understand why do I have this hip pain or
Mhm.
wrist pain or whatever you have. And then we're believing, and then we're doing the work. So
Mhm.
um what does it look like for people who want to get a green light from a medical professional to work with you? How does that work? Can you do that via Zoom? How do you work, and what's that look like?
Yeah, so for me, when I see anybody, I like to work collaboratively with people. So even for someone to see a doctor and get the green light even from them, ruling out any, structural damage, body organ damage, things like that. I think that's okay. That's important. Working in a hospital, I've seen many things. Many people come in for, just common symptoms you would think would be nothing, but they could be something more serious like cancer or anything else, right? There are
Mhm.
so many different medical diagnoses out there. So it's important to get that rule out, because that also gives you a green light where you can rule out a lot of major pathology. And then to work with a therapist, for us to get that green light is helpful, because then it's like what I've told patients before when they come to see me, even when I was working in the hospital outpatient, I would be like, hey, your doctor sent you here. Your scans are fine. Your doctor wouldn't send you here if they thought something was really wrong with you, like dangerous. So you can move, you're allowed to move, because you've had people sometimes they haven't moved really for years because
Yeah.
they afraid of the pain is one thing, but they're afraid they're doing damage also.
Yeah.
And then it's really trying to educate them and be like, no, like it's okay. You'll find that your nervous system as a whole will calm down, because and I've told people this just kind of straight, just to be like, your nervous system thinks this is dangerous right now to move. And so to move will be the way you kind of calm your system down, really. It teaches your body that it's safe to move. But it makes such a difference, right? Because I've had people, I can just give them a few exercises to do, and they come back a couple of weeks later, pain is at least half better. At least they have a smile on their face now,
Yeah.
after years of dealing with pain, right? And something as simple as that, like exercising. I had another patient who, she's young, she's 22, and she's working on more of the mental work with like a psychotherapist, so like a TMS psychotherapist. And so she asked her to see me to help work on more of the movement component.
Yeah.
But for this patient, she even didn't feel comfortable going to her therapist talking about exercise and movement, because she was like, well, I don't, what do they know exactly
Yeah.
about that work? So I'd rather talk
Yeah.
to somebody who does this all the time. And so I think it's just even having that confidence, and trust to just be like, okay, you do this. Can I do these things? And that's all this patient would ask me. She would just ask me, like, am I allowed to run? And am I allowed to sit in this car for this long? She was taught so many things at her age that she wasn't allowed to do, even from another physical therapist, taught her all these things that they were bad for her. And I just kind of had to flip all that around to be like, there's nothing wrong here. You saw the doctor said you're okay. You're getting help here, which is great. And now this is the kind of the final piece. And I mean, I only saw her maybe for like 4 sessions, but she's back to running a mile, sitting in a car for an hour, not being afraid of what chair she sits in, you know. And it was just all those things just to her to get the green light to be like, okay, it's okay for me to do these things. I'm not going to hurt myself.
Yeah.
And sometimes people just need that permission almost. They kind of have this concept, they call it like permission to move.
Yeah.
Some other countries talk about that. Yeah. And so that sometimes people are just looking for that, just to get that permission that it's okay. And I think that's what we can provide at least.
Yeah.
Mm.
Yes. Not everybody has that, but
Mhm.
when they do, the trust is missing to be able to move until they get this green light, this permission to move. So if do you work across state lines? Like,
I do, yeah, sorry. So I am licensed in New York and New Jersey under my physical therapy license. Then outside of those states, I do coaching worldwide outside of those states then.
yeah. So that's not, I love the label of coaching because it just gives you so much permission to help more people because if somebody doesn't live in New York, but they would like to get coaching from somebody who also can give an educated, yes, it is safe and good to move.
Right.
That just does so much for the brain. And
Sure.
so yeah, that's great. Any advice for people who are kind of stuck in that? We've gone backwards. Okay. So we basically started this interview with talking about the emotional work, and now we're looking at belief and science. So normally people's journey is the other direction.
Right.
But what advice would you give for people who are still, they're not even looking at symptom story? I mean, that's what we talked about with yours. Yours was grief and parenting, and there's a lot of stuff in there that was causing the symptom. And so I'm sure that your symptom story changed, much like mine was, that I'd overused my entire body. And now I realize I was under chronic stress, fear of rejection, fear of shame, loss of love, or perceived loss of love, that all affected my nervous system. And now I know it had nothing to do with how I was using my body. But I had to get there to where I believed that. What advice would you have for people who are still in the journey of, maybe they read Sarno's book, but they're like, wait, is this me though?
I mean, if people are able to work with somebody, I think that helps. I mean, for me, I guess I speak from experience. And so if I didn't work with somebody myself, I don't think I could have made those next steps and learned a lot more. Because I think when you work with anybody who does the work, knows it, has been able to help other people with it, it's like kind of any other profession out there. You know, you're better able to almost mentor somebody because you know what works, maybe what doesn't work as well. You can tailor this to somebody individually. And I mean, I know cost can definitely be a factor. I get that. You know, coming from a PT background, I know that's a concern for a lot of people. And I just tell people, like, I get it 100%. It's, you know, we try to think of anything with regards to money, like investments. So if you're able to, it's an important investment. It's your health. And again, this could help you in the long run as well. You know, it's we do this work, but you know, we know that a lot of our health is affected by our emotions, and we hear all about stress affecting our health for so many years now.
Yeah.
This work is absolutely important in doing that. When we talked about anger before, we've got a world with a lot of disease, and it's a lot of research pointing to the fact that anger can be a big part of that, and not learning how to express anger, you know, healthy ways of expressing it. And, you know, because we're taught maybe from a young age, from our life experiences, it's not a good emotion, it's dangerous. In our faith, we're taught these things too, right? Like, not from a young age, anger's a sin and don't do it. But it's plenty of experience, stories in the Bible, and it's used for a righteous reason. You know, it's very different. We're not talking about road rage here. We're talking about healthy ways to express your anger because it's good for you, but it is good for our health. And I think more of the research is proving that. And so that's what I would try to tell anybody if they're able to, because if they're already doing the work on they read Dr. Sarno's work, they've done the online programs, there are many free programs. I did a lot of these things myself too. And that's why I say I speak from experience. Like, I did a lot of stuff on my own initially, And it was only then when I felt like I wasn't really making progress is when I decided to work with somebody. And then that really kind of pushed things over where the connections were made a lot easier, you know?
Yeah.
Mm.
What you just said about anger in the Bible, um, totally agree. I think that road rage is just a byproduct of repressed rage and showing up in the wrong places. And the Psalms are just such a beautiful example of David being angry,
Mm-hmm.
calling out to God in his anger.
Yeah.
So I think you're right. There are different types of anger, but I think that God is a really safe place to go to say,
Mm-hmm.
I am mad and this is how I feel.
Sure. Mm-hmm.
Yeah. Okay. In closing, any questions you wish I had asked you or anything, any last words of wisdom for people?
I know before maybe we were just talking before we got on about kind of being a Christian. I don't know if you wanted to
Yeah.
add that part because I know we were kind of discussing that at least, and I thought it was an interesting question. From my own experience, you were asking me like, do I still identify as being a Christian? And yes, I do. You know, with my experiences, you know, I've grown up my life this way. But I think you were telling me this yourself, if I can mention that, just you had to learn kind of your own truths more so about God, maybe differently from what you learned growing up, and that really helped you in your journey and your recovery. Is that what you're telling me at least?
Yes, I think my faith had to become my own
Mm-hmm.
and to work through and to work that through that with God, as specifically in relationship to who he was, because
Mm-hmm.
my view of him had changed into something I think that was inaccurate. Um,
Right.
so now I see him and feel him as somebody who is for me and good. So
Mm-hmm.
yes, that's correct. How about you?
So, you know, it's so like some parts to this that I was thinking about at least was, you know, I hear from people like that concept I was saying, telling you before when it came to grief about like God wanting this. It's kind of that idea of like God wants us to suffer, you know, and
Yes.
I hear things like that. And I would say if we look at God as a loving father, no parent wants that for their children. You know, we don't prefer them to suffer. We try to avoid it. How many times I tell my daughter to avoid doing certain things so she doesn't get hurt, not doesn't always listen, you know, and things happen, but we learn from it, right? And
Yeah.
so even for myself growing up, I had this viewpoint of God being kind of that angry dad or strict dad. And, you know, we learned this idea of oh, very legalistic and I got to be careful and I got to make sure. And I was very involved in church and these days I still am, but you know, when I was growing up, you know, serving in the altar and, you know, teaching Sunday school and all doing all different things as well. But a part of me also felt like I had to do these things because otherwise I was going to get in trouble, you know, in
Yeah.
trouble, for example. And so I really had to
Yes.
unlearn that. But what helped me too is I actually spoke to some young priests who are like in our diocese, and even speaking to them, they were telling me like it's okay, you know, you don't have to do everything. You know, everybody's there
Mm.
to participate and support. God doesn't expect that from you. So, you know, if you're struggling there, if you need a different place to go to, maybe to grow closer to him, that's what matters really. So kind of getting that green light we were talking about, even getting a green light from them to maybe check out different things or try something else was so helpful, you know, because that was a big conflict for me of what I felt like I should be doing and what I really wanted to do, right? Which I know that's kind of that conflict creating some of these symptoms as well, or could create a lot of
Mhm.
these symptoms actually. So changing that mindset was really critical for me because I think, you know, that conflict I had for me over the years developed different symptoms. Another thing I think about is we were talking about the anger before, but I think anxiety is another one too. You know, I think many times people are told if you are anxious, it means you don't have faith. You know, you don't believe in God. And I would say, you know, the Bible, there's hundreds of times of it being said that do not be afraid, you know, fear not. And it's not shaming, it's not belittling critical. It's really just telling us like, it's okay. You can still be anxious. And, you know, when people say that, it's invalidating because, you know, to say to somebody who's been through trauma, abuse, war, poverty, anything, to tell them that you shouldn't be anxious, you should just trust in God, you could still believe in God, but your nervous system at this point is really primed because of your experiences that you just have a more sensitive nervous system. That's okay. So it'll just take maybe more time to calm it down. But to tell somebody that you know, again, the two don't go together, but it's what I've heard as well, you know, growing up at least. And
Yeah.
so I think that making those connections for me is just another thing that helped me in my journey, you know. And then one last thing I just wanted to mention was as I try to help people and work with people, especially from the faith background, many people, this idea of they feel like they're meant to suffer for kind of like ever, and they just
Yeah.
kind of, they kind of cite like St. Paul's thorn in the flesh.
Yeah, that's what I was thinking of. Yeah.
You're thinking of, okay, it's like the
Yeah.
reason. And what, and I get where people come from, like they read it, but I was like, St. Paul's also, a different person for what he went through, what, persecution of the church, things like that. He's a very different person. But I would say look through the gospel and look at all the healings that have happened, that Jesus, all the countless healings, people who were sick, with paralytics, lepers, blind people, the woman who was bent, years of like suffering, right? But they were made better, they were made well. And so that's what I would just kind of say for anybody else too. Like, it is possible for you, even if you've been struggling with any chronic symptom for a long time, it's still possible to get well.
I love that. I love that. A lot of what you just said with biblical references just resonates with me. I think that fear-driven behaviorism, legalism of I have to do these things. Like I said, it's fear-driven, it's pressure-driven. It's not this God laid it on my heart and inspired me and love-driven activity. Right. And I found in my journey that I was doing a lot of that stuff out of earning validation or security in the Lord or approval of man. Approval of man, really, that was a lot of it, which is people pleasing. And so I like that you're dividing those out differently, because it doesn't mean that sometimes God is going to call us to do some of those things that you cut out. Maybe later he will give you inspiration to do it. But it's just from a different place in our hearts and or in our minds, that is not nervous system primed by trauma driven type of thing.
Right.
Yeah. And it matters. It really does matter for healing. Okay. What was the last thing you just said? You said it is still possible to heal, or it is possible to heal. What did you just say?
Yeah. I was saying for people who feel they're meant to suffer forever, and that's their lot in life, I would just say for the people, if we want to just reference looking back at the Bible for all the healings that have occurred, many people that were healed. And I think people from their own experiences in life, we just need to find these people who can share these stories. There are so many stories out there, people healing. I think it's getting encouragement from those stories, at least to believe, have the faith that you can heal as well.
Yeah. I will probably name the podcast title that.
Okay.
All right. Well, thank you. I appreciate you. I appreciate your story, what you're doing. I'm going to put your website link in the show notes. Any other, besides the website, anything else you would like me to put in the show notes?
No, I mean, the website has the information on there. People can just get in touch with me that way, make an appointment, or call. My phone number's there as well if you want to call. My email is bobby@painrehabpt.com. So if there was an email that people wanted to use instead, they could email me as well.
Okay, that sounds great. All right. Thank you.
Thank you.
And thank you to everybody watching. I will see you again in a few weeks.